Hi, I'm Teresa Swenson, an orthopedic physician assistant at Tristate Specialist. I'm also the outpatient total joint replacement program care coordinator. Today I'd like to thank you for choosing Tristate Specialist along with Riverview Surgical Center for your upcoming outpatient total joint replacement. Our goal is to provide you with a positive, safe, and rewarding surgical and recovery process. This video is designed to act as a guide as you navigate the steps of preparing for and recovering from your total joint replacement. In addition to this video, you will receive an outpatient total joint handbook to reference, which I'm going to go through with you today. The more prepared you are for your total joint replacement, the more successful you will be with your recovery. So let's begin by going through the outpatient total joint handbook. First of all, why are you having a total joint replacement? Osteoarthritis is the most common type of arthritis and more than likely the reason you are having your joint replaced. Osteoarthritis occurs when the flexible, protective tissue at the end of your bones wears down, causing the bones within the joint to rub together. Your symptoms might include pain, stiffness, swelling, tenderness, and deformity of the joint involved. Initial treatment might include over-the-counter medications, rest, activity modification, bracing, and injections. When other conservative treatments are no longer offering you any relief, total joint replacement becomes your best option. Here we have a cartoon version of a normal healthy knee. You can see this shiny, smooth cartilage at the end of the bones, good space in between the bones. Here is an arthritic joint. The shiny cartilage has started to wear away, bone spurs have started to develop, and now there's less space in between the bones and they're actually rubbing together. Over 1 million total joint replacements are performed annually in the United States. Once requiring several days of recovery in the hospital, total joint replacement patients are now returning home within 24 hours of surgery. Better pain management and improved surgical techniques allow for patients to recover in the safety and comfort of their own home. What is a total joint replacement? Total joint replacement is a surgical procedure in which parts of an arthritic or damaged joint are removed and replaced with a metal, plastic, or ceramic device called a prosthesis. The prosthesis is designed to replicate the movement of a normal, healthy joint. As you can see here, an arthritic knee. Here is a knee replacement, metal, and a plastic bearing in between. Here is an arthritic hip. Again, a hip replacement, metal and plastic. So why have an outpatient total joint replacement? Well, recovery in the safety and comfort of your own home is possible following total joint replacement surgery. The costs associated with your surgery are decreased in the outpatient setting, along with the risk of infection. Sick people hang out in the hospital. I don't want you there with them. Careful patient selection and an organized team approach to your care before and after surgery allows you to recover in the safety and comfort of your own home. Patient selection begins while you are being evaluated by your surgeon. The best candidates for outpatient total joint replacement surgery are relatively healthy, fit, motivated, and committed patients. Weight, current health status, and previous medical conditions will be reviewed. Patients being considered for outpatient total joint surgery also must have a dedicated support system, or what we refer to as a personal assistant, that is willing and able to perform tasks for the patient once they return home. The organized team approach to your care continues once you return to your home. Your surgeon will be in contact with you on a secure medical portal via your cell phone. Physical therapy and nursing services will be provided in your home. The outpatient total joint program care coordinator, that's me, will also be contacting you to answer any questions and to monitor your progress. So what are some common questions? Well, first of all, what are the major risks? There are risks to any type of joint replacement surgery. Infection and blood clots are two serious complications that concern us the most. We routinely use antibiotics in the operating room. To decrease your risk of infection, you will take antibiotics for a week following your total joint replacement. To help decrease your risk of blood clots, you will be placed on a blood thinner following surgery, typically aspirin. As with all orthopedic surgery, there is a risk of nerve or blood vessel injury as well as fracture. Additionally, the implants that are placed can become loose from the bone or the plastic may wear over time. So what type of anesthesia will you have? The nurse anesthetist will discuss different options with you when you come to the surgical center for preoperative teaching. Anesthesia will also meet with you the morning of your surgical procedure. Typically, you will have a spinal anesthesia along with a local nerve block, which will improve your pain control following surgery. Do you need help at home? Well, we've touched on that before. You will need to select somebody, again, your personal assistant, who will provide assistance to you when you are sent home following your joint replacement. Your assistant can be a spouse, a family member, or a friend. Your assistant will provide transportation to your therapy appointments and help you safely navigate returning home. Your assistant will monitor for any changes in your health status and will communicate to our team as needed. How long will you be at the outpatient surgical center? Typically, you will be discharged home mid-afternoon following your total joint replacement surgery. Outpatient physical therapy will be arranged by your nurse prior to your discharge home. So now that you've scheduled surgery, the month prior, there are many things that we can begin doing, such as social planning. You will be able to walk using crutches or walker within hours of your surgery, but you will still need help at home for the first couple weeks with tasks such as cooking, shopping, bathing, and doing laundry. Make sure you have planned for support from your assistant, along with family and friends during your recovery time. Let's start getting things ready at home. You can organize your household to allow a clear path for your walker, install safety bars or a secure handrail in the shower or bath, have a stable chair with a firm seat cushion and 2 arms, install a toilet seat riser with arms if you have a low-profile toilet, get a shower bench or a chair for bathing, remove all loose carpets and throw rugs. You can even begin preparing some meals and placing them in the freezer. A prescription for a walker and a toilet seat riser will be given to you by the outpatient total joint replacement care coordinator when you schedule surgery. Any medications that your surgeon would like you to take prior to surgery will also be called into your pharmacy. You'll need to schedule a pre-op history and physical with your primary care provider to obtain labs, EKG, and medical clearance prior to your surgery, basically saying that you're healthy enough to have surgery. If you have not seen your dentist in the last 6 months, you will also need to have a routine appointment to make sure there are no underlying problems. You can also begin doing exercises at home. The stronger you are prior to surgery, the better off you're going to do after surgery. You can do the ones that you're comfortable doing. There's several pages of exercises in here that we're going to flip through because physical therapy will actually go through those with you the day of surgery. So 1 week prior to surgery, you'll need to stop taking any anti-inflammatory medications to include ibuprofen, Advil, Aleve, Mobic, Celebrex. If you're unsure what medications you're on, please talk to your pharmacist. You'll need to stop any herbal supplements, and that's simply because we don't know how they interact with surgery. If you're on Coumadin or Plavix, you'll need to ask your provider when you can stop taking that. And please avoid any skin injuries to the surgical site, shaving, cuts, sunburns, scratches. Don't show up to the surgery center the day of surgery with a big scratch across your knee because the dog jumped up on you. We will have to postpone your surgery. Go ahead and pack an overnight bag with some loose-fitting clothing with elastic or drawstring waistband, some slippers or shoes that are easy and safe for you to get around in. You can pack a toiletry bag, some books, magazines, your cell phone. Bring your walker, your crutches, or your cane, whatever it is that you plan on using after surgery. Bring a copy of your medications and your insurance card. Please don't bring any valuables, money, or jewelry to the surgery center. So 1 day prior to the surgery, tomorrow's a big day. Somebody will call you from the surgery center and remind you what time to be there. They'll also have you take a shower the night before surgery with antibacterial soap, nothing fancy. I just want you to take a normal shower. Don't scrub or irritate the skin. I want you to sleep in freshly laundered pajamas and bed linens. The next morning, I want you to get up and take that shower once again before you come into the surgery center. Don't apply any lotion to your skin. Do not eat or drink anything after midnight. Now, you may take your medications in the morning with just a sip of water, and the nurse will go over those medications with you the day before surgery. Again, print a copy of your medication list to bring along with you. Remove all piercings, metal, jewelry, and nail polish prior to coming to surgery. All right, it's surgery day. So you'll check in to the surgery center. You'll change from your street clothes into your hospital gown. The nurse will hook you up to the monitors and start your IV. Anesthesia will come in and place the nerve block. Doctor will come in and mark the surgical site and answer any questions that you may have. From there, we're going to take you back to the surgery area. And depending on how long this or which surgery you're having, it'll take anywhere from an hour to 3 hours. From there, you'll go to the recovery room. You'll be monitored as you recover from your anesthesia. Therapy will come in at that time. They will help you get out of bed for the first time. They'll also help you change into your clothes. You'll begin eating some small, frequent snacks and begin drinking fluids. We'll go ahead and hook that Polar Care up, which is the ice machine, and the CPM if it's ordered. And you'll keep that on anytime when you're not walking. You'll actually take these home with you. You'll use your incentive spirometer as directed. You'll ask for pain medications as needed. The nurse will go through your pain medications with you. And then obviously get some rest. All right, surgery's done and it's time to go home and recover. So we're going to have you pack up your belongings and head home or to the nearby motel if you live greater than 30 miles away from the surgery center. Prior to being discharged from the surgery center, the nursing staff will explain your home medications that will be used for pain control, blood clot prevention, and to prevent nausea. You will have a discharge folder that will include written instructions to refer to along with your scheduled appointment to be seen by your surgeon. All right, once you're home, I would like you to refer to your total joint replacement discharge instructions sheet included in your discharge folder. These are specific instructions for taking your medications, wearing of the compression hose, incision site care, and also list the time and date of your first follow-up appointment to see your surgeon or Teresa in the clinic within 1 to 2 weeks following your surgery. Home is the best and the safest place for you to recover and rest. I want you to drink fluids, eat healthy, and perform your daily exercises as instructed by your therapist. Remember to keep your leg or arm elevated, use your Polar Care ice treatment to keep your swelling controlled, and apply your CPM if it's ordered. Here's a copy of what the outpatient total joint replacement post-op instructions look like. Again, it covers everything from your dressing care, blood clot prevention, compression hose, your pain medications. You will be sent home on both a short-acting narcotic and a long-acting narcotic. For the first 2 to 3 days, I want you taking these medications routinely to keep your pain under control. As you become more comfortable, I want you to begin weaning off of those narcotics. Our hope is to have you off of all narcotic pain medication within the first couple weeks of surgery. Again, keep that leg or arm elevated to keep your swelling under control. Your diet, I want you to include high-protein small meals. That'll help with the nausea and also help you recover from surgery and heal. You may experience some constipation from the pain medications and just your lack of activity. So make sure you're drinking plenty of fluids, and you may need to use an over-the-counter stool softener. Again, your appointment has already been made to see your surgeon or myself following surgery. Here's some common questions that patients have asked me over the years, so I have written and included those in this packet for you. A patient checklist. Go through this the night before surgery to make sure that you have everything that you need and that we've covered everything. And again, a place for any questions. If you do have any questions, please feel free to call me at these numbers. This is the surgery center. They will get in touch with me or be able to answer your questions, or you can call the office and speak to me personally. Again, I want to thank you for choosing us for your total joint replacement surgery. If you have any questions or concerns, do not hesitate to give me a call.